Testicular examination is very important because it tells you what's normal and what's abnormal. So usually it's recommended to check your testicles at least once a month. Similar to when women check their breast at least once a month, looking for breast lumps or anything abnormal with the breast. And that's the same thing you should do with your testicles. For example, it's knowing what's normal and what's abnormal. So it can be normal to have one testicle larger than the other, which is usually the right testicle larger than the left, and it's also normal to have one testicle hanging lower than the other, which can usually be the left testicle hanging lower than the right. Testicular examination is also important to identify any signs of infection, inflammation, lumps and bumps, swelling of the scrotum, which we'll talk about later, as well as anything that you might feel is abnormal. Now, the best place to do a self-examination is usually in a hot environment, such as when having a hot bath or in the shower, because the skin of the scrotum relaxes and allows the testicles to hang down so you can examine properly. Ideally, you want to do this in a standing position. You can also stand in front of a mirror. And for those who have partners, you can also ask your partner to examine your testicles if you're not really someone that remembers to do it. But I would definitely recommend examining your testicles yourself so that you are familiar with your own testicles. So let's imagine that this is a testicle, okay? So when you're examining the testicle, the first thing that you want to look at is just a general look. Imagine this is in the scrotum, so you want to look at the scrotum, look for any swelling of the scrotum. Also look at the whole genital, look at the penis, look for any signs of rashes, any unusual skin changes like ulcers or warts, which can be an indication of a sexually transmitted disease. If there's swelling in the scrotum, that's usually called a hydrocele, which is usually due to some other factor such as trauma or cancers, for instance. And then you want to feel. When you feel the scrotum, you can actually feel that it's fluidy or that there is a fluid-like swelling in the scrotum. Then you also now want to feel the testicles. You've got your right and your left testicle. It doesn't matter what you feel first, but what you want to do is you want to get your testicle, which is usually the size of a bird's egg, like 15 mil, or it could be the size of a small chicken egg, which is about 35 mil. So this egg is slightly bigger than what a normal testicle would be. So you want to put your thumb and your fingers between the testicle, and you want to gently roll your fingers along the testicle. You can start from the bottom and then work your way towards the sides and towards the top. You know, when you're feeling the testicle, you can feel for the texture. You know, is it smooth? Can you feel any lumps and bumps? You know, like I said, you can also feel the size. If it's too small, there's a condition called testicular atrophy, where basically it can be due to a congenital disorder such as Klinefelter syndrome, which happens at birth due to a chromosomal abnormality. It can be due to any underlying illnesses where you basically had chemotherapy or radiotherapy. It can be due to side effects of medication. It can be due to excess alcohol intake. It can be due to stress. And usually you need to be referred to a specialist for further investigation. Also remember, the shape of the testicle is important. Like I said, it's an oval egg-shaped testicle. Any difference in shape can be due to distortion, due to a fluid or lumps, for example. So after feeling one testicle, then you want to proceed to feel the other testicle as well. But also remember that it's not just the testicle to examine. You also want to examine the tubes that lead to the testicle. You've got a tube called the epididymis, where basically your sperm is usually stored after maturation, where it can now travel to fertilize the egg. You've also got spermatic cord and veins called vas deferens, you know, which are also leading up to the testicle. And this usually supplies blood to the testicle. So these are the conditions to look out for when examining your testicles. Remember, you have to do it once a month. Do it standing up. Best to do it in a warm environment, such as in a hot bath or having a hot shower during or after. And if there's anything abnormal or unusual that you're worried about, speak to your doctor.